Do you find it hard to talk to new people? Does the idea of a party or a meeting fill you with dread? If you nodded along, you're not alone. And you might be asking yourself, is this just shyness? Or is it something deeper? It's easy to mix them up. On the surface, shyness and social anxiety can look the same. But here's the crucial difference. Shyness is a personality trait, while social anxiety, or social phobia, is a mental health condition. One is feeling nervous, the other is living in fear. So how do you know which one you're experiencing? In this video, we're breaking down the 12 signs you might have social anxiety. Category 1. The cognitive signs, thought patterns. Psychologists note these are the internal software glitches of social phobia. 1. The mind-reading assumption. You're convinced you know what others are thinking about you, and it's always negative. Psychologist Dr. David M. Clark calls this imagined catastrophic evaluation. Example: they're looking at me because they think I'm awkward. 2. The catastrophic prediction. Before any social event, you experience anticipatory anxiety with detailed predictions of humiliation. I'll say something stupid, everyone will laugh, and I'll never recover. 3. Post-event rumination. The event ends, but your anxiety doesn't. For hours or days afterward, you replay conversations, analyzing every word and gesture, convinced you made a fool of yourself. 4. The spotlight effect distortion. You believe everyone notices your anxiety symptoms, sweating, blushing, trembling hands, and are judging you for them. Psychology research shows most people don't notice nearly as much as you think. Category 2. The behavioral signs, what you actually do. These are the safety behaviors psychologists observe that maintain the disorder. 5. Avoidance as a primary strategy. You consistently avoid situations where you might be the center of attention. Parties, meetings, dates, even speaking up in small groups. 6. The escape plan mentality. When you can't avoid, you attend but with elaborate exit strategies. Sitting near the door, driving separately, having a rescue call planned. 7. The invisible shield. You engage in subtle protective behaviors during interactions, speaking very little, avoiding eye contact, staying on your phone, or clinging to one safe person. 8. Substance reliance. You need alcohol or other substances to get through social situations. Psychologists recognize this as self-medication that worsens the underlying condition. Category 3. The physical and emotional signs, body and feelings. 9. Physical symptoms that feel uncontrollable. Your body reacts to social situations as if facing physical danger. Rapid heartbeat, trembling, sweating, nausea, dry mouth, blushing, or even panic attacks. 10. The performance paralysis. You freeze or blank when attention is on you, even for simple things like introducing yourself or signing your name in front of others. 11. The should versus want conflict. Psychologists identify this as significant distress interference. You want to connect with people, but your anxiety creates such distress that it interferes with work, school, or relationships. You know your fear is irrational, but feel powerless against it. 12. The loneliness feedback loop. You experience chronic loneliness despite craving connection because the very mechanism that seeks to protect you, avoidance, isolates you. The clinical psychologist's threshold. When is it a disorder? According to the DSM-5, the diagnostic manual psychologists use, it becomes social anxiety disorder when persistent, lasting 6+ months, intense. Fear is disproportionate to the actual threat, distressing, causes significant emotional pain, impairing, interferes with normal functioning, not caused by substances, medication, or another medical condition. If you experience several of these signs consistently, particularly with impairment in your life, it's worth speaking with a professional. What psychology says you should do next? Step 1. Self-compassion diagnosis. Dr. Kristen Neff's research shows, stop judging yourself for judging yourself Acknowledge this is a real pattern, not a personal failing. Step 2. The 2-week observation. Psychologists recommend keeping a simple log. Note situations that trigger anxiety, your thoughts and your behaviors. Patterns become clearer. Step 3. Seek evidence-based help. Cognitive behavioral therapy, CBT, has the strongest research support. Specifically, look for exposure and response prevention, ERP, the gold standard treatment. Step 4. The 1 experiment challenge. Psychologist Dr. Ellen Hendrickson suggests, pick one small safety behavior to drop this week. Order coffee without rehearsing. Make brief eye contact. The disconfirmation of your fear is powerful medicine. Recognizing these patterns is the first and bravest step toward change. Psychology has given us incredibly effective tools for social anxiety. The mind that built these patterns can learn new ones. Your anxiety is a signal, not a sentence, and signals can be rewired. Which of these signs surprised you? Share your number in the comments. Subscribe for our next video, How I Used CBT to Challenge Social Anxiety.